Welcome to Variations 4, pH and Lytes unit. We're looking at questions 13 and 14 in this video. Topic really overall is looking at three common fluids that we find being put into the body, water, normal saline, or D5W in a care setting. And what effect these have on fluid shifts, and just a little more discussion on fluid shifts in general. So we'll move to map number 4 and just kind of move through map number 4 to talk about question 13 and 14 together. So map 4 here tells us straight off the bat here that water is hypotonic. Now remember, hypotonic relative to what? So if we look at these two squares here, which one represents the body and which one represents water that we drink? Well, we just said that water is hypotonic. Hypo meaning less solutes, hypotonic relative to the body. And we can, when we say body, we're talking about intracellular fluid, we're talking about extracellular fluid, because remember, those two fluids are what? ICF and ECF are isotonic to each other. Water compared to these two fluids is hypotonic. So here's the body, here's water. So let's just talk about that. So what if you ingested a whole bunch of water? What would happen? Here's your hypotonic solution going into the ECF, into the vascular region, because maybe you drank way too much water, or we gave you way too much water in the hospital. We gave you an IV that over time turned itself into just water, like D5W ends up turning into water. What's going to happen theoretically speaking? Theoretically speaking, because this is hypotonic fluid in overload, if it was an overload, you're overloaded with hypotonic fluid, well, which one has greater oncotic pull? A hypotonic fluid or an isotonic fluid? Oncotic pull is the one with the greater number of solutes per milliequivalent. Which one has that out of these two? The isotonic has more solutes per milliequivalent, so it draws in the hypotonic fluid. So we would have fluid, water, leaving the blood vessels, moving into cells, causing cells to swell. Normal saline. If we give someone lots of normal saline, what's going to happen? Which way is the fluid going to shift? Well, this is a bit of a trick question. Normal saline, as we know, is isotonic. Isotonic compared to what? Compared to the body. So if you've got a blood vessel full of isotonic fluid and the cells themselves are isotonic, then in terms of fluid shifts based on oncotic pull, you won't expect much action there because they're both isotonic. However, why might we expect fluid portion here from the blood vessels to be moving into the tissues if it was overloaded with isotonic fluid? What concept that we just talked about in the last video would cause this isotonic fluid to potentially flow into tissues? You guessed it, it's hydrostatic pressure. So again, if you fill the blood vessel with isotonic fluid, put it into overload, that fluid is not necessarily going to flow into cells because they're both isotonic. but it will get pushed out by way of hydrostatic pressure into surrounding tissues. Next, we talk about D5W. D5W is kind of like see all of the above. What do I mean by that? Because when D5W is first infused into the patient, it starts out as isotonic. And we just talked about what isotonic fluid does. But in short time, the glucose is metabolized out of the bloodstream. And what you're left with is the water from that IV. And so you can default back to our discussion about H2O. Now, the fluid amounts that we give on our step-down units, like acute medicine and general surgery, the IVs we give, is not usually enough to be particularly fussy around these concepts. You'd have to be bolusing your patient quite a lot of fluid to start thinking in these terms. If we were to give our patient a hypertonic fluid, what would we expect? Like a 3% normal saline, which we do not often give on the wards. But if we did give them a hypertonic fluid, or let's just say they had like a super high salt intake and their sodium level was super high, or they're majorly dehydrated and so their tonicity was really high solute volume in the blood, whatever. There's a lot of reasons why, but say they had relatively hypertonic fluid running around the vascular space, which way would we expect fluid to flow? That's right. More solutes here than inside the cell, which is isotonic. So fluid is attracted to the solutes and drawn out of the cell into the bloodstream. And this can cause problems in and of itself, which we'll talk about later. But that's a direction the fluid will be drawn, to where there are more solutes per milliequivalent. These maps down here just kind of highlight what kind of fluids may be given on the wards for these conditions. It's really not written in stone. You see these fluids interchanged all the time, to be honest with you, on the wards, and it's not usually a huge deal. This map here just highlights what I talked about above in terms of if you pull too much fluid out of the cell, like in this case, the severe dehydration, you can cause cell shrinkage. And that could cause CNS issues, central nervous system issues. When you see these diagrams, please remember that the rectangles are events or conditions of the patient. The triangles are the signs and symptoms, and the circles are what we need to do about it. How do we diagnose or how do we intervene? This side here with the swollen cells is really talking about what happens when we drink too much water, which we talked about above.